Hello, I'm Mary Moncton, and this module is Module 4, Speech and Language Evaluations, part of Part 1, Birth to 3, Assessments and Evaluations for Deaf and Hard of Hearing Children. What you will walk away knowing today are the differences between speech and language, more specifically expressive language versus receptive language, English versus sign language, speaking and listening versus sign language. You'll also walk away knowing common terminology, best practices for a comprehensive evaluation, what tools are typically used and why, along with eligibility for speech and language services in early intervention. There is a difference between speech versus language. You will hear these terms a lot, and what speech refers to is the actual spoken language. What spoken sounds a child can produce. This is no matter the language, so it could be spoken for English, for Chinese, for Japanese. In addition to this, how their hearing loss impacts their spoken language is related to specific speech. Also, motor coordination and motor movements of the mouth are involved when we talk about speech, specifically how you articulate sounds, and the ability for a child to move their mouth in the right way in order to produce spoken sounds. Language, on the other hand, is how they use and understand language, no matter the mode. So whether it is spoken or manual language, such as sign language, it's how they use this. Social skills is another area under language, also referred to as pragmatics. Pragmatic skills involve how a child is interacting socially and appropriately across different situations. For example, how they use and understand language across situations, such as the way they interact with other people, is it the same at home as it is in their daycare, or as it is when they interact with same-age peers versus their siblings. Expressive language versus receptive language. Expressive language refers to how a child expresses themselves in their primary mode of communication. It's how they use language. Again, whether they're using it in spoken language or in sign language or manual modes, it's how they use it. For example, labeling objects, labeling pictures, and referring to people by name is an example of expressive language. How they use words to express what they want and what they need across environments is also considered expressive language. So any way that a child uses language is considered expressive language. Receptive language is how much a child understands or comprehends. How a child follows directions is another specific example of receptive language. If a child can point to an object when you name it, point out a person when you refer to them, or follows directions across different situations. How they understand another person's nonverbal communication is also involved in how they understand and comprehend language. Speaking and listening versus sign language. So again, spoken language refers to a spoken mode of any language, and typically here in North America, this usually refers to English. When referring to listening or audition, we're referring to what a child can hear through their ears or with amplification. So again, when discussing listening and audition, it's what a child can hear, not necessarily how they're comprehending or how they understand language. Sign language refers to the manual mode of communication in any language. So sign language not only can be referred to such as American Sign Language, but there are other manual languages around the world. American Sign Language is a language that has its own unique rules of grammar and syntax. And again, typically in North America, this is what is commonly used. Different regions and different areas have specific dialects and perhaps some differences in signing, but overall it follows a very structured grammar and syntax that's different from English. Other forms of sign language that may be paired with English, such as pidgin sign, sign exact English, or another term, conceptually signed English, where they follow English word order, is essentially some form of manual English and not considered American Sign Language. Some common terminology that you may hear during evaluations are age equivalency, which refers to a child's skill level when compared to same age peers. So if in evaluation your child shows skills that are scattered between 15 months and 18 months, but they're 24 months of age, their age equivalency would be between the range of 15 and 18 months. Normative data and standard deviation are terms that Cheryl referred to in Module 2 when she talked about specific terminology for assessment and evaluation. She refers to the bell curve and specific terminology with a visual. So refer to that module for more specific information related to normative data and standard deviation. Specifically, when doing a speech and language evaluation, a therapist or service provider might refer to your child's primary communication mode. And this refers to what mode of communication your child uses the most. It can also mean, because of the child's age, being birth to 3 and young, and still developing language skills, it could refer to what communication mode is used primarily in the home. Informal assessment. This is any assessment that is not standardized. And again, a standardized assessment is one that follows specific protocols on how to give the test, specific standards on how you need to score the test, and how many prompts or assistance you can give to a child when administering the test. So informal assessment is any other type of evaluation that can be used to assess your child's skills, but is not normed. So you will not have, there's no specific protocol, there's no specific way of having to follow specific rules in order to score it. Certain examples could be checklists, rating scales, things like that. Code switching is another term you may hear, and this is when a child, if able, has the ability to go between a spoken form of communication into a manual or signed form of communication. So that is referred to as code switching, if a child can go between the two. And a lot of children at this age experience that ability because they are still developing their overall communication skills. Auditory oral refers to a child who is able to use audition to listen and hear. Speech reading refers to a child's ability to read the lips of somebody else when communicating. And auditory verbal refers to when a child is using their audition and their spoken language in order to communicate. It also refers to a methodology in which sign language is typically not the primary mode, but more so reliance on listening and speaking first. Best practices for providing a comprehensive and valid speech and language evaluation is very pertinent when evaluating your child's communication skills at this age. The special ed law states that tests and other evaluation materials used to assess a student are provided and administered in the student's native language or other mode of communication unless it is clearly feasible not to do so. So similarly, at this young age in early intervention, it is important for a child to be evaluated in whatever mode of communication is their primary mode, or whatever the family reports is to be the child's strength. In addition, as speech-language pathologists, it is best practice for us as individuals to engage in those aspects of the profession that are within the scope of our professional practice, competence, and in addition to considering our level of education, training, and experience. I'd like to note here that not all speech and language pathologists have had experience with a deaf and hard of hearing child. We are all comprehensively trained and certified and licensed to practice. However, it is not required in our training that we work with children who have a hearing loss. And it is important that you talk with your service providers to ensure their training and their scope of practice with a child who has a hearing loss. In addition, a qualified professional should consider the following factors during the evaluation and in making appropriate recommendations for a child with a hearing loss. Such things to be considered are the communication needs and the child's and family's preferred mode of communication, the linguistic needs, the severity of the loss and potential for use of residual hearing, the child's academic level, cognitive level, social, emotional, and cultural needs, including opportunities for peer interactions and communication. So when we're providing a comprehensive speech and language evaluation at this age, all of these factors should be considered when making the best recommendations for a family. And because a child at this age could be using different modes across different situations, it is important to assess their skills in all areas. There are many different assessment tools that may be used when providing a speech and language evaluation for your child. An articulation test is something that specifically assesses how the child is able to use spoken English sounds. So for example, a speech therapist might show your child a picture of a dog, and what they're assessing is, can the child produce the sounds d, a, g. Not so much if they can label it or sign it or describe what it means. Simply, articulation means, can the child produce those sounds specific for spoken English? Single word English vocabulary test, however, is a more specific way to see what a child's word knowledge is. Expressive single word vocabulary tests assess if a child is able to label a variety of pictures or objects. Receptive vocabulary tests assess whether a child is able to identify a picture when someone states it. For example, if I were to show a child 4 different pictures and ask them to identify the picture of a dog, can they point to it and match what I say? These vocabulary tests should be given using the child's primary mode, so they can be given using spoken English or sign language or American Sign Language. And if the child shows that they have abilities in more than one communication mode, being able to differentiate between their skills for vocabulary, labeling, and identifying should be done in any mode that they show skills. There are comprehensive language tests that a speech pathologist would give in a comprehensive evaluation that is different from single word vocabulary tests. A comprehensive language test assesses more specifically how much a child is using their language and how much they understand of language. An example of this might be the preschool language scale. It involves following directions, identifying pictures, it engages in conversation with a child, and it is more comprehensive to assess their overall skills. There are some informal speech reading tools that may be used for children if appropriate. Typically, this may not happen at this age, but it is always an option in order to see if a child is making connections between when a person is using spoken English and if they can match that to pictures or objects. Pragmatics, or social language skills, is another area that in a comprehensive evaluation would be assessed. Examples of social language skill assessments, again, would be more of a checklist to see if your child is using social skills in a way that is similar to what is expected of same-aged peers. Specific eligibility criteria for services here in Texas are dependent on your family's early intervention team. Dependent on the initial evaluation, results, and specific diagnoses of the child, a referral for a specific speech and language assessment may be made. It is important to know that if a child has an auditory impairment diagnosis, AI services can be provided and ECI coordination is provided. It would be up to the ECI team, the early intervention team, to determine if a speech and language, an additional speech and language evaluation should be conducted. Families always have a right to request such an evaluation as members of the ECI team. Results from the speech and language evaluation will then determine if services are recommended as part of your child's early intervention plan. It is important to note, however, that AI services, and again, the service coordination are provided to the family for free if the child has the already diagnosed hearing loss. However, additional services such as speech and language services or physical therapy, occupational therapy, and the like may fall under a cost share for the state, which means that the family may need to pay for these services. Families always have the right to request a private evaluation and can seek out private practice services for their child.